Hello, everyone. So we're going to continue this video conferencing with some more information. I'm going to just add these as interesting elements come into my sphere from clinical practice. So one thing that we commonly see in women's health is hair loss, and I just want to talk a little bit about that with regard to the thyroid. Um, it's it's fine to be doing natural medicine, but we need to take into account these biomedical aspects. So, um, although I'm an acupuncturist and Chinese medicine practitioner, we use a lot of functional testing. We'll refer people back to their GP, and it's good to know when to do that. You can't be a one size fits all, but often, especially with autoimmune factors or thyroid care, there is a part to play in wider health. So, yes, you may need medication, but you may also need to have a look at your gut health and other ways in which we can support your immune system, because they are immune issues. So hair loss doesn't have to be because of thyroid issues. So when we're talking about thyroid issues, we're talking about hyperthyroidism and hypothyroidism. In hypothyroidism, you'll often see hair not coming out, not just from the head, but maybe from the eyebrows or other hairy parts of the body, or normally hairy parts will be losing hair. So we also know that sometimes hair loss is a side effect of some of the medications. So levothyroxine is often applied with much success for many people. So if that's the case, it may start quite a few months after you start taking the treatment, due to the hair growth cycle, which is around 3 months plus. You can have acute hair loss at different times, and it's worth thinking about how to diagnose this. So if either you're a client coming in, or if you're another practitioner, either in natural health or otherwise, thinking of that diagnosis differentiation, or differential diagnosis rather, to just check where the client's at. And if you don't know, either testing or referring is the way forward. There, in terms of natural support, there for thyroid care, there is sometimes natural pathways that you can take before taking medication. But again, that needs to be navigated per person, and it's not the sort of platform here with which you can say, do this or do that. And if you find videos or people that say do this or do that without meeting you in person, taking a consultation, this is where I sort of fall out a bit with the internet, and feel that you should definitely try and find a trained practitioner, rather than just listen to advice on the internet. So other ideas to have a look at are nutritional deficiencies. Sometimes these can be around B12 or iron and ferritin, of course, but we know sometimes blood ranges have also changed over the years towards the different NICE guidelines that have evolved over the years. So even if someone's within range, it might still be too low for them as an individual. So again, just having possibly a printout, if you can possibly get that from the doctor or the doctor's receptionist. I don't want to give the NHS more work to do, but it's important to see the levels for yourself, or take them to your functional or alternative or Chinese medicine practitioner, just so we can see what's going on, in terms of data and actual figures, not just whether it's good or bad. Lots of people I report now that they just don't hear and they assume that that's okay. Biotin is in a lot of over-the-counter supplements for hair and nails, and sometimes, we need to check what you're taking in terms of supplementation before you get blood tests as well, because they can sort of change the blood parameters. Other vitamins you might want to think about is vitamin C, E, D, and also zinc as well as a mineral. But then there are alternative issues. So if you're taking too much vitamin A, that has often been a cause of hair loss. So let's think about how to find your nutritional status. There are various bloods and urine tests that you can do to find out exactly what's going on. I've always found it interesting. I've got a French client who says that's one of the first things that they do as soon as they get to the doctor in France, which is to do a full vitamin mineral assay as well. I don't live in France, I don't know about that, but it sounds like a good plan. So there are other disorders and medical conditions that can cause hair loss as well. So it's not just these factors we've talked about already. Alopecia, and there are different types of alopecia, whether to do with fungal infections. There's something called effluvium. There's something called androgenetic as well. So they're around male pattern or female pattern. And this can be later on, often over 50 or 65 for women. Sometimes it can be after, obviously, chemotherapy or other intensive drugs, or indeed environmental toxins people are exposed to. So we can think about these in a wider basis, but I just wanted to unfold a little bit for you. Sort of hair loss has a broad base, and it can take a while to get that back to normal. In the strategies I've used in the clinic, often we have tested, we found out whether the thyroid and the bloods are okay, and if that's okay, we might move to the next level, which is gut health and nutritional health. We know that a lot of hormonal issues are downstream from gut health, so we know loads more about gut health now and how it affects our cognitive health and our future our future mental well-being. So it's, as you get older, you think about these things more, and lots of people are aware that they have to optimize now. It's not just a case of eating 5, 7, 9 portions of fruit and veg a day, although that can mostly help a lot. There's lots of nuanced factors for individuals, and it's not really a one-size-fits-all. But either we're taking steps towards health or away from health, and that's just a sort of easy overview for reflection. If, what am I doing today? Is it for or against? I don't know, without being too fascist about, lifestyle or fun times or whatever, that might not be ideal for your well-being. But in any case, I appreciate you listening today, and I'll do some more of these videos, and possibly they'll sort of grow into a sort of information platform. And, I can share a lot of this with clients or wider community. I'm Catherine Dandridge. I have a Chinese medicine acupuncture clinic with functional testing in Perthshire in Scotland. I trained in the UK and in China at the Beijing University of Chinese Medicine. And as lots of practitioners, there's an army of holistic and functional and alternative health practitioners who are becoming more and more trained in more and more areas. So don't be afraid to reach out to some professionals, even if it's not me. and just get a heads up of their approach. But you know, you can use this as a basis if you are suffering from hair loss. Okay, acupuncture, really helpful. And I've tried some herbal medicine, some supplemental regimes after testing. And sometimes for hormonal care, obviously it's medication or referral back for further hormone support. So look, it's good to know that we're not all the same, but it's good to accept that we do need all of our data to be there before we just guess. That would be my vote from it. And if you're going through extreme stress, anything that you can do to get support to tune that down, even if it won't change the level of stress that you're currently experiencing. And we hope as well that, you know, really high acute stress doesn't last on and on and on and on. That you do get respite from that level of adrenal response. So, all right, I'll stop waffling now and wish you a good day. All right, thanks for joining me.